Good morning. I'm Kari Burrell, Community Health Planning and Partnerships Director at Foundation Health Partners. Foundation Health Partners is very pleased to be the lead sponsor for this year's Go Red event. Thank you for joining us this morning for our community conversation. Just a little housekeeping before we get started. Please remember to keep your microphones muted throughout the presentation. If you have questions for Dr. Wrenn, please type them into the chat box and he will answer as many of the questions as he can at the question and answer period at the end of the session. We are also excited to announce a few upcoming events. Please mark your calendars for the following. Next week on Thursday, February 11th is Healthy Heart Day at the Alaska Health Fair. You can get your blood pressure checked and pulse oximeter readings while learning more about heart health. The following week, on Friday, February 19th, Foundation Health Partners will be presenting another community conversation with Dr. Sally Mangum, who will be discussing lifestyle strategies to protect against cardiovascular disease. And finally, you won't want to miss this year's main Go Red event for women. It's a digital event on Friday, February 26th. Now, in keeping with the Go Red goal of raising awareness for heart disease among women and encouraging action to save lives, Dr. Romel Wrenn will share the risks that COVID-19 has for heart health and what you can do to protect yourselves. Dr. Wrenn is an alumnus of Louisiana State University and received his medical degree from the Tulane School of Medicine. He completed his cardiology fellowship at Brooke Army Medical Center at Fort Sam Houston in Texas and served in the United States Army Medical Corps for 9 years. He is board certified in internal medicine, general cardiology, echocardiography, interventional cardiology, and cardiovascular CT. He worked in private practice in Louisiana until March 2012 when he came to Fairbanks and joined the Harry and Sally Porter Heart and Vascular Center. Dr. Wrenn is the author of ABCs of the Human Body, a workbook for children, and of Corpy, the Little Red Corpuscle, also a children's book. I am pleased to introduce Dr. Romel Wrenn.
Good morning. Thanks, Kari. And thanks to Janet and the American Heart for having me here this morning. There are only 3 people in the room besides myself, and we're all wearing a mask. There are more than 6 feet away and behind plexiglass. So I'm going to take my mask off to make it a little easier for individuals to understand me. We have to be COVID cautious. So this morning, I would like to share with you insights into COVID-19 and how it affects the heart. My objectives would be to give you a brief background of the current pandemic, the types of viruses that we see in life, how viruses infect and kill the host, the mechanism by which SARS-CoV-2 causes infection and subsequent injury to a person, and also discuss some of the direct and indirect cardiac effects of SARS-CoV-2, touch on therapy and also prevention. Now, it's been determined that the etiologic agent SARS-CoV-2 that causes severe acute respiratory syndrome is one of many bad coronaviruses. In fact, there are at least 3,200 coronaviruses that infect bats, and only 7 coronaviruses that are known to infect humans. Currently, as you know, we have a pandemic going on, and this pandemic is due to a virus that's been named Severe Acute Respiratory Syndrome Coronavirus 2, and this virus is known to cause the disease, coronavirus disease 2019. Now, on 31 January 2020, the Health and Human Services issued a declaration of public health emergency related to COVID-19 and declared a national emergency in response to COVID-19. And on 13 March 2020, the president declared a national emergency in response to this virus. Here's a picture of COVID-19 showing its spike proteins. In December 2019, a cluster of cases of viral pneumonia were linked to a seafood market in Wuhan, China, and was later determined to be caused by this novel coronavirus. We know that SARS-CoV-2 is enveloped, is non-segmented, is an RNA virus, and has what's called a positive sense. So what does that mean? A positive sense viral RNA is similar to messenger RNA, and so it can easily be translated to the host cell, whereas a negative sense RNA is complementary to RNA and has to be converted to positive sense RNA before it can be replicated. If we take a look at the types of viruses, there are 7 classes of viruses. RNA viruses are 3 types: influenza, Ebola virus, reovirus, hepatitis C virus are the 3 types of RNA viruses. There are reverse transcribing viruses such as HIV, hepatitis B, and there are also DNA viruses such as parvoviruses and herpes viruses. Many of you may know that parvoviruses infect dogs and cats, but there is also a parvovirus called B19 that infects humans. If we look at the coronaviruses that infect humans, 4 are common, and they actually would cause a common cold. But there are 3 that are deadly. The Middle East Respiratory Syndrome, or MERS virus, the SARS-CoV virus, and SARS-CoV-2, which is the novel virus that we are fighting at this time. Generally, when a virus infects a host or a human being, we inhale this virus through the nose, or it comes in through the mouth and sometimes through the eyes, and it may settle in the mouth, the throat, in the trachea, in the airways, and even into the lungs. Generally, when we are exposed to SARS-CoV-2, that's an incubation period from 2 to 14 days, on average 5 days. Symptoms occur at 8 to 16 days, but on average at 12 days. And we become infectious before the onset of symptoms. Antibodies, or seroconversion, occurs at about 5 to 10 days after symptom onset, and generally a diagnosis can be made only after symptoms are present. Where do we find the viruses? Well, there's a large number of viruses in the nose, in the throat, in the sputum, also in the stool, low levels of the virus in blood, and not nearly as many in the urine. Who's affected? Well, men more than women, the older individuals more than the young individuals in terms of severe disease, and individuals with cardiovascular diseases such as high blood pressure, coronary heart disease, heart failure, individuals with cancer, respiratory disease, diabetes, or others who may become severely ill with this virus because of being compromised to begin with. How do people present? Well, 80% of individuals don't become extremely ill. Some are asymptomatic. Some have mild illness with fever, sore throat, dry cough, feeling weak, may have a nausea, vomiting, loose stools. Some become moderately ill and may even have pneumonia with fever and cough. It may have an abnormal chest X-ray, but 80% do not become severely ill. However, 20% of individuals do become severely ill and have a low oxygen level with severe pneumonia and may develop a critical state where there's inflammation throughout the body. There may be encephalopathy or changes within our mental capacity, heart failure, kidney failure, and subsequently death in individuals who become critically ill. This virus can infect the upper airways, the mouth, the lungs, cardiovascular system, the immune system, liver, gallbladder, pancreas, gastrointestinal tract, the urinary system, female reproductive system, male reproductive tract, nervous system, the eye, mammary glands, and even the skin and fatty tissues. So how do viruses cause pathology? What's the viral pathogenesis? Well, it's the sum of 2 things. One, virus replication, and also the immune response. How we respond to the virus plays a major role in how deadly the virus may become. This is a picture of influenza virus, and it just shows here where it attaches to certain receptors on the human cell. When it attaches, this virus then is taken within the cell, and it begins to replicate. Now, this can happen with minor illness, or it can be deadly, because after the virus enters the body, usually in the eyes, the nose, and mouth, the virus begins to take over the human cell, particularly in the nose and throat. So one with influenza would have a severe sore throat and then develop fever because of the immune response, where white blood cells and antibodies and inflammatory molecules go to those areas to eliminate the threat. Killer T cells attack and destroy tissue that's harboring the virus, particularly in the respiratory tract and in the lungs, where the virus tends to take hold. Now, in a healthy person, this process works and they recover within days or weeks. But sometimes the immune system's reaction is too strong, destroying so much tissue that the lungs can no longer deliver enough oxygen to the blood, leading to low oxygen levels and death. And also in influenza, there may be such severe damage to the lungs that bacteria can secondarily infect a person and cause death due to post-influenza pneumonia due to Staphylococcus. Here's a picture of SARS-CoV-2 showing how it may attach to a human cell. And again, as similar to the influenza virus, it enters the cell and begins to replicate. One big difference is where SARS-CoV-2 attaches. It attaches at this ACE2 receptor. This receptor normally in the body will actually tone down the inflammatory response, because ACE2, which is found throughout the central nervous system, upper airway, vasculature, lungs, liver, gut, kidneys, heart, eyes. It's located in these areas. And in these areas, that receptor will tone down angiotensin 2, which is a neurohormone that we have circulating in the body. And normally, it would deactivate angiotensin 2 and allow blood vessels to relax, stops damage to the heart, reduces inflammation, reduces overgrowth of cells. But because the virus is attaching to the ACE2 receptor, angiotensin 2 becomes out of balance, and there's so much circulating that it causes blood vessels to constrict, causes salt and water retention, severe inflammation, and what we call oxidative stress and fibrosis. This leads to what's been called the cytokine storm. Now, what are cytokines? Cytokines are circulating signaling molecules, and they signal white blood cells and other inflammatory cells to come in to try to fight the virus. They're secreted by certain cells in the immune system. They mediate and regulate immunity. It causes a tremendous amount of inflammation and overproduction of certain blood cells. When the virus attaches to the ACE2 receptor within the heart, this virus can cause cellular death right within the heart, causing the heart to become weak, or even causing what's called myocarditis. There can be indirect damage to the heart due to these cytokines, which are the inflammatory molecules. And this can cause blood vessels to clot, reduce blood flow to the heart, can cause, again, inflammation within the heart, and can cause the heart to become so weak that patients go into what's called cardiogenic shock due to extremely low blood pressure. Cardiac arrhythmias may occur, and one may suffer cardiac arrest. This again shows that as a primary target, the heart may be damaged, leading to low blood pressure, extremely high heart rate, slow heart rate, arrhythmia, or sudden cardiac death. Or in someone who has underlying heart disease, because of the stress on the body, one may develop too much metabolic demand, have not enough cardiac reserve, and may go into heart failure and subsequently die. The four common cold coronaviruses don't tend to affect the heart at all, where it's been shown that with the Middle East respiratory syndrome and with SARS, there have been some cases of cardiac damage. It appears that SARS-CoV-2 has a strong affinity to the heart, probably because of this ACE2 receptor. Also, because of the tens of millions of people who have been affected, it may be that we're seeing so many more cases of the heart being involved in SARS-CoV-2. Now, when patients are evaluated by cardiologists, we can do blood tests such called troponin I or internal proBNP to see if there's damage to the heart. Or we can visualize the heart with an echocardiogram. If the right ventricle is involved, we may see a dilated right ventricle. When the left ventricle is involved, it may be dilated, it may become weak, and one may go into heart failure, leading to cardiogenic shock. In some cases, there's inflammation and fluid around the heart, called the pericardial effusion, which may compress the heart and cause what's called cardiac tamponade. There may be so much stress that one can have what's called a broken heart syndrome or Takotsubo syndrome. And one may present with an actual heart attack in progress, which is called an ST elevation MI. What can we do? Well, presently, the treatment we have for SARS-CoV-2 is convalescent plasma. We also have a drug called remdesivir. Corticosteroids, because they are strong anti-inflammatories, can actually reduce mortality by 30%. And there also are the intravenous immunoglobulins, or the antibody cocktails that can be used. The best approach still is first to avoid getting infected. And you all remember the stay-at-home policy that we had for a while, and still we should avoid having a crowded, being involved in a crowded facility unless we are wearing masks as we should. If we do wear a mask, what we find is that if one is wearing a mask and you're 6 feet away from someone who's infected wearing a mask, and that person should sneeze, there's 0% risk of getting infected. If you're within 6 feet and that person is wearing a mask and you're wearing a mask and that person should sneeze, there's only 1.5% risk of infection. If you're not wearing a mask and someone who is infected is wearing a mask and that person should sneeze, the risk is still low at 5% chance of transmission. If that person who's infected is not wearing a mask and sneezes within 6 feet of you, but you are wearing a mask, the risk is up to 30%. And 90% risk, if you're not wearing a mask and the person infected is not wearing a mask and sneezes within 6 feet, there's a 90% chance of infection. So we can go to work or to school, wear a mask, and be careful and do quite well. The other thing we can do is to get vaccinated. As you know, this virus is beginning to mutate. It mutates when it infects an individual. If we become vaccinated and do not become infected, then there's no chance for the virus to mutate. So what we should do is become vaccinated and do not become infected. Thank you. Okay, we're ready for questions now. We have a question from someone about dietary changes and reducing risk of inflammation. Even before knowing about issues with viruses, we do know that if one is on a low inflammatory diet, you can reduce the risk of inflammation. So what's the low inflammatory diet? Well, a low inflammatory diet would be one that's rich in fruits and vegetables because of all the antioxidants that are involved in fruits and vegetables. Of course, one can take antioxidant supplements, but those have never been shown to be truly beneficial in any large study. So basically, if we eat green leafy vegetables, if we eat 3 to 5 servings of fruit a day, we can reduce the risk of inflammation. So that's a question about having received a cardiotoxic agent such as adriamycin. Now, what's interesting about adriamycin is that, yes, it can cause the heart to become weak, but in those individuals who recover, we would expect there not to be an increased risk unless there's ongoing heart failure. One thing that we can do for anyone who has been exposed to COVID-19 or been diagnosed as having the infection, if there's lingering symptoms such as shortness of breath or fatigue, then one should have 3 things done. One, 2 types of blood tests, a troponin I and a BNP or N-terminal proBNP to see if there's evidence for inflammation or heart failure, and also have an echocardiogram done to check the strength of the heart muscle. Zinc supplements is a great question. There are some theories that it may decrease viral replication. I don't know if any large studies proving that though. And in terms of any supplements, be zinc or D, we have to be careful not to throw the body out of balance. In general, it's better to receive, for instance, if one thinks zinc is good, then find that nutritious source that would have that, or vitamin D, for instance, it's better for us to get sunlight. Of course, here in Alaska, we recommend vitamin D3 because we don't get enough sunlight from September through May. Again, no large studies showing that supplements are beneficial. I do not think that they would be detrimental. So in terms of Fairbanks controlling the virus, I think Fairbanks is doing a fairly good job. Of course, we all know that we go out and we see people who are not wearing a mask or whatever, but we're fortunate in Fairbanks that we do not have a large population. And to my knowledge, Fairbanks is doing a very good job. The numbers have been going down. Okay, that seems to be it. Thank you very much. Oh, if you've had the virus, are there any screenings you would recommend? Well, you know, this is quite interesting. When we have a patient coming into the hospital who needs a procedure and we test to see if they are SARS-CoV-2 positive or COVID-19 positive, then we actually delay any procedures for about 30 days because we know there is increased risk for damage to the lungs if one receives sedatives or if they have to have anesthesia within 30 days of the infection. So we have to be very careful for at least 30 days after infection. And again, if one has symptoms like unusual fatigue or shortness of breath, then yeah, there should be some testing done. And as I mentioned, having blood tests done to make sure the heart is not involved, a BNP, internal proBNP, or troponin I, and undergo an echocardiogram, particularly in someone who's an athlete, that should be done. Other testing that can be done would be, for instance, a primary care provider may decide to do a chest X-ray if after examination the lungs do not sound clear. But again, one should report to their primary care provider for guidance. Okay, thank you very much. Appreciate it. Okay, great, thanks.
So thank you, everyone, for joining us this morning. We look forward to seeing you again back here on the 19th for a conversation with Dr. Mangum about lifestyle practices that can protect your heart. Hope everyone has a great day and a great weekend. Thank you.